Hi everyone, my name's Dawn and I'm the Executive Director of FND Hope UK, and I'm joined today by Dr. Christopher Symeon, who's a neuropsychiatrist from the Wolfson Rehabilitation Unit, and that's based at Queen Mary's Hospital, which is part of St George's NHS Trust. Hi Chris, thank you very much for joining us today. How are you?
For having me. I'm great, thanks.
Good.
How are you doing?
Yes, really well, thank you. I was hoping that we might be able to talk a bit about the Wolfson Rehabilitation Programme that you do at Queen Mary's. And I guess my first question is, can you tell me a bit more about what it is that you do at the Wolfson and what it is that you actually offer?
Yeah, sure. So Queen Mary's, as part of the Wolfson, offers an inpatient rehabilitation service for FND. So as part of our pathway, we have outpatient services, a 5-day program, and this is just part of that pathway. So we have beds here, 4 inpatient beds for patients with FND. What we offer here is usually about 6 to 12 weeks worth of admission, which is kind of an MDT pathway. So we have various disciplines here, such as OT, physiotherapy, psychology, psychiatry, neurology, specialist nurses. So we've got quite a few different professionals here who work with patients in the rehab pathway.
So you mentioned MDT. Could you just explain what you mean by MDT for those that perhaps don't understand what that means?
Easy to slip into acronyms. So, that's a multidisciplinary team. So basically that's a variety of experts that have particular expertise within their field. But the thing about this place is that we all work quite holistically together as well. So people aren't working off in silo by themselves. We get together a lot, we do joint sessions, and so we really kind of build off everyone else's kind of skills. That holistic approach, I think, is really necessary for FND, working with the kind of biopsychosocial model of how FND occurs and why it continues in most patients. We find that using that MDT approach really has the best outcomes if patients are invested in the biological side of things, the psychological side of things, as well as the environmental systems around them.
So I found that I was very lucky that I was able to come and be part of the rehab programme last year. And before I actually came to the programme, I needed to kind of go through an assessment. And I guess I'd like to ask you a bit about why it is that you do that assessment and why that's important.
I think it's really key for us to really explain what the process is like to patients, so that people don't just get here and expect something different for a 12-week process. So I think it's for us to be able to explain to patients what we do, but also for us to get a really good understanding about the patient's history. So we start by doing things like exploring the background, exploring how the symptoms occurred, things like past medical history, past psychiatric history, and we ask kind of the usual doctor questions that we usually ask. But it's an MDT, again, multiple disciplines in here in the session with me. So I'll usually be with an occupational therapist and a nurse. And so we look at things from other angles, such as how people are coping at home, how their relationships are, all of these things that occur outside of just the purely medical side of things. I think it's really important to assess engagement as well, and people's insight into FND, because sometimes knowledge of FND is not that great, and people get to us still quite confused about what the diagnosis is. They might even still challenge the diagnosis and not quite believe it. So we have to really get to the bottom of, does this patient understand what the diagnosis is, and are they willing to engage with the kind of holistic biopsychosocial approach that we deliver here. I don't think it's fair to say to someone to come in for an admission if they're still challenging the diagnosis and wanting kind of further investigations and things that usually doesn't work out very well.
No, and I guess it's because they're probably, if they don't quite understand that diagnosis, they probably wouldn't be very engaged maybe within the program. Is that kind of what you're kind of saying?
Yeah, I think it's about buy-in, really. Does someone believe that they have FND? Do they accept the diagnosis? Are they coming to us saying, I want help with this, I get it, and I want help with it, and I'm going to really engage in this kind of this therapy? It's an intensive program. Patients are doing 4 to 5 sessions a day sometimes. There are rest breaks built in, obviously, but it's quite intensive. It can be quite tiring. So we need to make sure that someone's going to be able to engage in that process and make the most out of all the expertise that's here.
So could you explain what a typical week might look like for somebody that then comes into your inpatient program? Because you talk a lot about different sessions. So it would be great to perhaps get an idea of what that typical week looks like.
So I think the whole program here revolves around goals, and the goals are patient focused. So we won't tell patients what their goals should be for the admission. It's up for the patients to come to us and say, I want to be doing X or Y, whether it's being able to cook independently, whether it's being able to drive their kids to school, it's different for each person. So patients will come to us with specific goals that we work up during the first week, and then these are reassessed over the period of time that they're here. Within the first week, usually it's a bit slower, so that people get to grips with the ward environment, meeting all of the various team members, getting a timetable put together. And then from the second week, I'd say things pick up, and people are having those 4 to 5 sessions a day for 5 days a week. During that time, there's things like ward rounds. So I do my ward round on the ward with the junior doctor. There's the therapy sessions they'll be doing. There's activity sessions. So we have activity coordinators on the wards that do kind of the non-therapy based interventions. So they might be kind of games nights or going out to local kind of events or parks. That's really useful for patients to kind of have that peer support with each other as well. And there's goal planning meetings as well. So that would be therapy led, and that's where the goals are revised and reviewed, and kind of progress is monitored. And so it sounds a bit kind of like an exam, but it's not. It's just checking in to see how things are progressing, whether there's anything we need to be doing differently to help people reach their goals.
So I guess from that, you're kind of saying that the therapy is almost based on that individual rather than this is the set plan that everybody is going to follow.
100%. So no two patients get the same kind of treatment. It's tailored to the patient. So, someone comes in with motor functional symptoms, they might get a different experience to someone who has mainly kind of speech changes or dissociative seizures. They'll get another kind of experience here. It's the same skill set, it's the same team, but it has to be tailored to each patient differently, because no two FND patients have the same experience symptom-wise. It's different for everyone.
So why do you think it's kind of important for people to be able to? So I guess when I'm talking about important, not all patients will be able to kind of come to the treatment centre. So I guess it's why is it important for those people to kind of come on your programme? What's your kind of expectation of those people coming onto your programme and kind of leaving?
So in terms of kind of outcomes, I guess is what we're saying. So thinking about outcomes in this program, it varies. So sometimes we'll have patients who come to us who've been disabled for 20 years and just come about their diagnosis, and they might have a great recovery. A similar case might come up later on who doesn't have such a great recovery. I think there's a lot of variables in how people do. The people that do the best are the people who engage in all of the aspects of the therapy intervention. So we find that some people might be particularly reluctant to engage with the psychological side of things because of the stigma associated often with kind of the psychiatric or mental health aspect. And that's really difficult, because I think that's key. It's not the only part, but it's one of the 3 kind of parts of the jigsaw puzzle that fit together. And I think the people that engage with all aspects, the people that we see do very well. And when I say do well, we have people come in and go back to work, and people come in and go go to the dances with that, you know. So it can be a really wide variety of outcomes. Equally, there are people who don't do so well. In those kind of circumstances, we can signpost them on to kind of other appropriate treatment options as well.
Brilliant. Is there anything else that maybe I need to ask you that we haven't covered, but gives everybody a good idea of what you're all about?
I think the message to get across is that services are limited in the UK, and we all know that, and access to the intervention is really difficult. A lot of what we do here in the initial couple of weeks, I guess, is sometimes undoing bad learning, really things that have happened to patients in the past, being told that it's kind of all in your head, all that kind of negative experience that people have. Also, the mistrust of professionals that occurs often because people have gone around the houses and seen so many different professionals before arriving at the diagnosis, by which point you lost faith in the system. So a lot of what we're doing here is trying to undo that kind of, negative experience. So I think it's really kind of useful for me to say at this point for people to try and kind of reframe the processes. We're trying to educate GPs, we're trying to educate other healthcare professionals. It's just not that well understood in their environments, and so we're trying to outreach and help the cause from that early stage. I think another thing to get across is it's really frustrating for everyone to have to wait on our list for 9 months, 6 to 9 months, and that's so frustrating because nothing happens during that time period. And that's something we're trying to do now, using other forms of therapy to try and make use of that time as well. So we're trying to formulate at the moment a way to use digital innovations to help people access certain types of therapy from home. We're also trying to liaise more with the community therapy team, so that when patients are discharged from us, they're not going back to nothing. They're actually going back to a community neuro rehab team that can help support them with their improvements that they engaged with here. So yeah, we're trying to kind of do a lot of that outreach work, a lot of service development, but it will take time.
It does take time, it really does, but I do want to say that the programme is absolutely amazing. I did amazingly well, and I think a lot of people that I have spoken to have said what an amazing programme it is. So I'd just like to say thank you on behalf of FND Hope of the great work that you're doing, and obviously also the great work that you're doing kind of outside of that as well, which is to try and expand that particular knowledge, which is absolutely amazing. So as part of our FND week, you're also going to be doing some kind of activities for us, which is a great, fantastic again. Do you want to just give our viewers an idea of what it is that you're planning on doing for our World FND week?
We've got the talk that's happening, so that's an open day talk, and again linking into what I just mentioned about educating other professionals, we're inviting a whole host of professionals from all over the southeast really to come and learn about what we're doing, to learn about how to refer to us and access therapy in the first place, and also just explain a bit more about FND and what it is and how they can start to help to manage things within their own teams. We're having a number of fundraising events, so we've got a rollathon, we've got a dance off, a bake sale, so hopefully all of that will kind of contribute to raising some money and awareness for FND.
Thank you so much, Chris. I'm absolutely in the work that you're actually doing. It's absolutely amazing, and thank you so much for taking the time out to have a chat with us. It's really appreciated. If you wouldn't mind saying your name and that you are FND aware and are you, that would be amazing. Thank you.
So, I'm Chris Symeon. I'm a consultant neuropsychiatrist and I'm FND aware.
Thank you very much.
Thank you.